is Monutamang, and I have been working as a physiotherapist in Dungtsho National Referral Hospital since January 2017 after I graduated from Navodaya College of Physiotherapy, Raichur, Karnataka. So apart from being a physiotherapist, during my leisure hours, I also write, and as of now, I have written 3 books. In outpatient department, we come to duty by 9 in the morning, and we provide consultation services. We treat patients and also provide rehabilitation programs to the patient. And we also spend around an hour teaching the physiotherapy students of Faculty of Nursing and Public Health. And our OPD services close by 3 in the evening. However, the colleagues working in inpatients come as early as 8 in the morning, and then they provide physiotherapy services irrespective of public holidays and Sundays. So here I would just like to explain 3 very important components that makes a good physiotherapist. So first one is our ability to listen to the patient, because until and unless we listen to the patient very carefully, we are not able to empathize them and then provide proper interventions to meet their requirement. And second component that makes one a good physiotherapist is competency in skills and knowledge. And third component is our speaking skills. So unlike other professions, we must be able to motivate people to do home exercises program and also come here daily to do physiotherapy. So when I say that one, there are some of the patients who keeps coming to our department for last 2 or 3 years. So that requires huge amount of motivation on part of patients, and that can be done only with convincing explanation.
So can you explain the meaning of physiotherapy?
In short, physiotherapy is a profession. And in Bhutan, physiotherapists and physiotherapy technicians are the professionals who provide physiotherapy services. According to WHO, physiotherapists assess, plan and implement rehabilitative programs that improve or restore human motor functions, maximize movement ability, relieve pain syndromes, and treat or prevent physical challenges associated with injuries, diseases, and other impairments. So it basically means physiotherapy services are provided to the individuals and populations to develop, restore and maintain their maximum movement and functional ability by doing proper assessment using knowledge and skills that are very unique to the physiotherapist or physiotherapy professionals. So international standard classification of occupation have classified physiotherapy as separate entity. So when I get this opportunity, I also like to make some clarification, that is, physiotherapy by many, including medical professionals, has been confused with the interventions. But let me state that physiotherapy is a profession and not interventions. We accept patient referrals from different health professionals, and also patients have direct access to physiotherapy services. So after that one, we do proper assessment and design proper or appropriate interventions.
Why is physiotherapy important for us?
Physiotherapy is an inevitable part of multidisciplinary a team in patient management or in patient care, because our unique role in patient care is to improve the quality of patient's life and restore their movement and functional independence and alleviate pain. Basically, we provide a continuum of care during the acute phase subacute phase, and according to the requirement of the patient, we also provide long-term physiotherapy services. This can be explained with an example, that is, with the increasing number of stroke patients, in 2015 alone, they have, the report says, every day a Bhutanese had a stroke. So that is a huge number, and the number is just increasing. So once the patient gets stroke, they will be admitted in the hospital, and after they are medically stable, they are discharged from the hospital. But medically stable does not mean that they are functionally independent, and that is when they have to spend vital aspect of their life doing rehabilitation programs in physiotherapy department.
So who all can be helped through physiotherapy?
All walks of people can avail and get benefited through physiotherapy services. So firstly, since April 2014, we have started women's health physiotherapy services, in which expecting mothers can avail antenatal exercises service, and also after they have delivered their babies, they can come for postnatal exercises. So that basically says that the people are getting physiotherapy services even before they are born. Then in pediatric physiotherapy, we provide rehabilitation services to the pediatric population, and in inpatient services are provided to all the appropriate patients admitted in wards, including adult ICU, neonatal ICU, and pediatric ICU. And once they become medically stable, they are taken to the inpatient physiotherapy center, where the rehabilitation services are provided. After recognizing physiotherapy services as an integral part of patient care, physiotherapy services in Bhutan was introduced in 1984 with the help of an expatriate physiotherapist, and since 1994, we got our first national physiotherapist, Dr. Sangadurji. Since then, we have been providing physiotherapy services. Still then, we are fairly recognized profession, and as much as Ministry of Health is trying to prioritize us for human resource development and trainings, as of now, we have only one rehabilitation specialist, and the existing general physiotherapists are not undergoing any kind of specialization courses.
Okay. So does it mean that right now it's understaffed?
I don't mean to say that we are understaffed. Rather, we are, we don't have enough specialist physiotherapists to provide that specialized services.
When a person comes to you to seek physiotherapy, how do you know that what kind of therapy that person needs?
So that we decide after we do very proper assessment, which is very unique to the physiotherapy professionals. And after we do assessment, we come to the conclusion that is known as provisional diagnosis. And as per our diagnosis, we give or we design interventions and plan of care to meet short-term goals as well as long-term goals.
So is it painful to undergo a physical therapy?
The very fact that you asked me this question suggests how misunderstood we are. So I would just like to make 3 clarifications. So first one is, patient often comes to our department saying that doctors have sent them to get electric shock. And we have grown up watching Bollywood movies in which electric shock is portrayed as very painful experience. So that could be one reason why people presume that physiotherapy is painful, and that is when most of the patients choose to go home instead of coming to avail physiotherapy services. So it is understandable when it comes from general public. The very fact that we work with patients is to alleviate their pain. Then second misconception that we have among the health and medical professionals is that physiotherapy cannot be done during acute phase. But I would like to clarify that physiotherapy can be done in acute phase because we give them very special services using our knowledge and skills, and we try to restore their functional ability without causing any extra pain. So I would rather say that it is earlier the better, because sometimes patient walks into our physiotherapy department after they have developed considerable stiffness and contracture. So at the time, the physiotherapy professionals are not able to help them as much as we could have helped if the patient have come earlier.
So are you saying that there won't be any discomfort?
Of course, there will be minimum discomfort, but we will try to we'll try to implement our interventions within the tolerable pain. We don't cause any extra pain, and the pain that we cause during our intervention should not last after we completed our treatment session.
How long does a session last for?
So the duration of the session depends on the conditions of the patients. So firstly, in neurorehabilitation physiotherapy, we are supposed to spend at least 2 hours with each patient, but as of now, due to the human resource and infrastructure constraint, we are only able to give 1 hour to each patient. Then in women's health, we have 30 minutes exercise session, and in pediatric physiotherapy, there too, due to the human resource constraint and then the infrastructure constraint, we are able to provide only 1 hour therapy session to each patient. And in inpatient department, depending on the conditions of the patient, we spend a minimum of 30 minutes to 1.5 hours. Then in orthopedic OPD, we spend around 15 minutes doing assessment and providing consultation services, and 30 to 45 minutes to treat them.
So normally 2 hours is the required time.
2 hours is what we are supposed to do, but understandably, because of the human resource and then infrastructure constraint, we don't have enough space to accommodate all the patient coming in. So that's why we are not able to do as much as we are supposed to do.
Now, what are some common cases that you come across as a physiotherapist?
I'm very afraid here that I may offend my colleagues by excluding the patients that they see every day. But I feel I would do justice by saying that in orthopedic physiotherapy, in 2017, we have seen more than 10,000 low back cases, and the neck pain would be the next. And in pediatric physiotherapy, commonly seen cases are cerebral palsy, Down syndrome, developmental delay, and autism. Then in neurorehabilitation, we see the highest number of stroke and spinal cord injuries, which common people call them as paralysis. And in inpatient, we see patients with mobility impairments due to numerous disease conditions, and especially trauma, stroke, chest and lungs conditions. Then with the increasing number of patients and some segment presenting with the complication, I see very urgent requirement of specialization in various fields to meet the requirement of the patients, and also to be able to provide specialized physiotherapy services towards achievement of universal health coverage.
So when you mentioned about trauma, does it mean accidents?
Accidents, and that can also be due to the occupational hazards, like someone working in construction site, they may also fall down from there, or maybe they get hit by the stones, then they come to hospital, and during their stay in the hospital, we provide physiotherapy services.
As you mentioned that most of the common cases are lower back ache and neck ache, so why do you think so?
I can't exactly point out the exact cause of low back pain and neck pain, but I can somehow share with you some of the factors that might be contributing towards neck pain and low back pain. So first thing, we presume that it could be it could be because of the posture that we adopt. With the advancement of science and technology, most of the time we are involved using our phone and then doing some computer works. So at the time we are maintaining that posture of the neck, which is very detrimental to the health of that health of the neck. So that is, we are supposed to at least look up, yata antani, but that things we are not doing because most of the time we are engaged and we keep on doing this thing. Then that leads to the stretching of the back muscles, and to certain extent the muscle is able to tolerate the pain, or they does not respond to certain extent, but after certain extent when they are not able to tolerate that load, then the pain is a signal that the muscle is trying to say that something is wrong in that area. And also most of our people who comes here with the complaint of low back pains are the laborers. So what they do is they spend most of their time lifting heavy weights without proper mechanics. That can also be one factor that leads to low back pain and neck pain.
Okay. So in short, it is to maintain correct posture.
Correct posture.
And to take break in between.
To take breaks in between and to adopt proper lifting methods and all.
Now, what treatment options are available for these conditions?
So to explain in a very layman language, for those who are in pain, we try to manage pain and alleviate pain with various manual therapy protocols and also physical and electrical modalities. And for those who have lost joint range of motion, we work towards achieving or restoring normal joint range of motion. Then for those who have muscle weakness, we try to strengthen, and for those who are functionally dependent, we try to make them functionally independent. And these days people are increasingly searching exercises that can be done for them through Google and YouTube. But I would like to suggest that they come to physiotherapy to know their condition, because every condition or different people will have subjective conditions. So some of the exercises that YouTube or Google teach you might do more harm to you than help. So to know what kind of exercises that they can do, they can always seek our help.
Even if it's workouts?
Yeah, because low back pain, let me explain the two things that cause low back pain, which may appear very similar. That is, one can be due to the spinal stenosis, where the spinal canal will be narrowed, and other thing can be caused by the spinal stenosis, that is due to the prolapse of the intervertebral disc. So if you go to the Google, they may teach you back extension exercises, which is very helpful in case of intervertebral disc prolapse. But in case of bony spinal stenosis, it is going to cause more harm to you than help.
Alright, so let's consider I am here for a joint ache. So after undergoing the physiotherapy, will I experience any sort of muscle swellings?
There wouldn't be any sort of muscle swellings after physiotherapy session. Rather, we work towards reducing swelling with as simple a technique as elevation and icing. And we can also perform lymphatic drainage to reduce swelling, but it requires specialization, and as of now we don't have one.
It's just another misconception.
Another misconception. And people even say that physiotherapists or the physiotherapy professionals have the hand of a crab. Once we hold it, we don't let them go. But that is the misconception that people are having. So if you ask anybody who have already availed physiotherapy services, they will be in a better position to explain so that the general public can get cleared of that misconception.
So can we do physical therapy at home?
A physical activity of any sort is recommended at home. With the advancement of technology, we are increasingly adopting sedentary lifestyle, which leads to various kinds of lifestyle diseases, particularly hypertension, diabetes, and musculoskeletal dysfunctions. So, if people choose to do very simple physical activities at home, that would prevent such a dangerous diseases. And for those patients who comes to physiotherapy, we prescribe them certain sets of exercises to be done at home, and we call them home exercise program. And what is interesting is we have seen very positive correlation between the home exercise program compliance and patient's condition improvement. So physical activities of any kind is highly recommended at home, but if they have some kind of a medical conditions, they can always come to physiotherapy department and seek our help so that they will be able to do specific exercises depending on their conditions.
Okay. Earlier you mentioned that backache is one of the commonest case. So would you like to demonstrate few exercises that we can do?
So if your work is to spend prolonged time in front of the computer doing typing works and other computer works, so what you can do is you can just take 1 or 2 minutes breaks in between and then perform a very simple exercises, like just you do your elevation of your shoulder and then just rotate in this way. And other thing that you can do is you can rotate in this way, you can just stand up, and then maybe you try to rotate your neck like this in this direction, and after you have done with that direction, then you can change the direction like this and spend some time looking up into the ceilings. So that would help you in preventing or getting into the neck pain problem. So you can just take break from your work after 30 minutes or 1 hour and then spend 1 or 2 minutes doing these exercises. If you are trying to lift things like the one that is in front of me, so most of us, we tend to bend down like this and then lift it up, which is a wrong technique, and that is going to hurt your back. So instead of trying to bend forward and then lift, what you can do is you can adopt correct lifting technique. That is, you have to first bend your knee and then hip, and then once you reach there, what you can do is you just have to keep your back straight and then lift it up like this. So that is going to be less harmful to your back. Then if you are spending most of your time in front of the computers, what you can do is, like I told earlier, you can just take break and then you just try to extend your back like this. Even if you don't have a table or a comfortable place to lie down and then extend, you can just stand up and then extend your back like this. And if you have a comfortable place in your office, what you can do is you just can lie down like this, and then maybe you can just be just lie prone and then be on your elbow like this, or you can also perform extension exercises like this. So when you perform these extension exercises, you can what you can do is put all the efforts from your shoulder and then relax your back, and then just maintain this position for around 10 seconds. And if you don't have back pain, maybe you can repeat this one for 2 or 3 times.
What are some of the techniques used by physiotherapy?
The one misconception that our people carry about physiotherapy is they say that job of a physiotherapy professionals is to do massage. So here I would like to clarify that physiotherapy professionals are not massage therapists. So the female who do massage is known as massasu, and the male who do massage is known as massasur. And there are also certain segment of people who take massage as a specialized course to elevate certain medical conditions, and they are known as massage therapists. I am not denying the fact that we don't perform massage. What we do is we perform soft tissue manipulation to increase the joint range of motion and then alleviate pain. So here, instead of massage, I rather prefer to use the term soft tissue manipulation. So to say that physiotherapist job is to do massage is as equal as saying that doctor's job is to give paracetamol. And there are certain techniques that we use or that we do every day. So first thing is electrotherapy, where we use electrical modalities to alleviate pain and as adjunct to our manual therapy programs. Then we also use physical agents like ice and heat. Then there is another huge branch that is known as manual therapy, where we perform mobilization, myofascial trigger point release, soft tissue manipulation, dry needling, cupping, and also there are certain parts of the manual therapy we are still not able to perform due to the lack of qualification. Then other things is we also prescribe home exercise program and rehabilitation programs. Then we also provide assistive device services, where we provide wheelchairs, then prosthesis and orthosis. And most importantly, we do patient education.
Well, how does physical therapy benefit our mind?
As a nation aspiring for gross national happiness and psychological well-being being one of the domain of GNH, let me take this opportunity to explain the link between physical activities and healthy mindset. I want to explain these things with two very simple examples. First one is, if you go for a morning walk or morning jogging, that would keep your mind alert, fresh and happy for rest of the day. Then Dr. Jeremy Siebold, Assistant Professor of Rehabilitation and Movement Science at University of Vermont, did some research, and she found out that moderate aerobic exercises can immediately uplift your mood, and that effect can last up to 12 hours. So another thing is, or the second example is, more than 90% of the patient who comes to physiotherapy are in pain. So when the person is in pain, they don't have peace of mind. So what we do is we prescribe them certain sets of exercises which they do and then get relief from their pain. So that contributes towards the happiness of the patient. So I think with these two very simple example, I explained the positive relationship between physical activities and healthy mindset.
Now, this is a very personal question. What is the most rewarding part of your job?
The most rewarding part for any physiotherapy professionals is that we get to deal with patients very directly, and if we are able to alleviate their pain, if we are able to increase their range of motion, and if we are able to make them functionally independent, then they express their gratitude towards us, which is very, very fulfilling things. And another time when we take joy is when the patient comes to our department in wheelchair, and after rehabilitation program and after our interventions, when they walk out from our department, they walk out independently. So I don't think there would be any more fulfilling reward than to see people who came to our department in wheelchair go out independently.